Thank you, Chair. Dr. James, you have rightly focused on the impact on patients of the pandemic, essentially of safety. But nevertheless, of course, this inquiry does concern primarily the well-being of those who are working in the NHS itself. And I wondered whether you've seen any discernible struggles. Have you seen examples of colleagues really struggling during recent months?
We do a regular members survey, and we did it right at the beginning of the pandemic and at stages within the pandemic. And what we found was that about a half of our members said that their well-being had deteriorated as a result of the pandemic. As has already been said, that there was also a differential impact on Black, Asian and minority ethnic doctors and staff generally. And we responded to that. We set up a special group that actually looked at their needs, looked at the particular response that we needed. That included a risk assessment to actually understand why they're at higher risk of contracting the virus, why we needed to put in special protective factors to ensure that they were safe at work, because actually feeling safe at work is another prerequisite to good well-being at work.
Absolutely. And have you seen any positive impacts of new ways of working or the general pressures that you've been put under?
I think what we know is that morale at work improves if people have a sense of control over their immediate environment. And I don't know anybody who comes to work wanting to do a bad job. You want to actually improve everything that you do for patients. And one thing the pandemic did do was that there was a lot of energy, particularly at the beginning. We had a very clear task that we needed to meet. I'm a practicing frontline clinician. We had to prepare a part of the hospital for patients who were COVID positive. And so everybody was brought together. We knew what we had to do. Solutions were found. I think that was energizing. I think on the part of management, people there was a renewed interest in the well-being of staff. People were much more visible, and actually, yes, the response from the public. It's always been a very challenging job, but suddenly there was this response, and there was free food arriving, and people suddenly arriving with a box of chalk ices, and and it was the symbolism of that people say, we know that you're really up against it. So I think there was that very positive response, and the level of innovation. And I guess the other important thing is remote working, which for many people has actually been a positive thing. I think there is a downside to it. I think we will experience digital burnout. I think we need a new set of rules around how we actually manage the digital offer. But there's no doubt that in terms of cutting down travelling, accessibility, we found that actually our meetings, the Royal College has gone pretty well all online. We had an increase in the number of people actually joining meetings and things like webinars. So it has improved access. So there have been some positive things.